today. Today's webinar, NHS Digital Maturity Self-Assessment Roadmap 101, is the first of a series of webinars we will be hosting on digital transformation in the NHS. During our webinar, you'll learn what is the NHS Digital Maturity Self-Assessment and why is it important, the four-stage programme, common challenges and strategies. With that, I'd like to introduce today's speakers. Andy Beale is a partner with Optimity Advisors and leads our digital transformation practice. He has over 20 years' experience supporting health and other organisations deliver high performance through data and technology. Joining him is Jeff Broom. Jeff is the founding director at Apira and has spent 20 years working in and for the NHS on IT-enabled change projects. He has specialist skills in business case development, specification and procurement for clinical systems. Before we get started, I wanted to mention that we welcome your questions throughout the webinar. All you need to do is type yours into the question window on the GoToWebinar control panel and hit submit. We'll get to as many questions as we can during the Q&A session after the main presentation. Secondly, we're recording today's webinar and we'll post it on the Optimity Advisors website. We'll send you an email once it's up in case you want to watch it again or forward it along to a colleague. Without further ado, I'd like to turn the programme over to you, Jeff.
Thank you, Jess. Most of you on this call probably do know that NHS England launched their digital maturity self-assessment tool in Birmingham on the 6th of November. And it's really asking all providers to assess for themselves the extent to which their services are supported by digital technology. But importantly, it also points the way to what use of systems should be, what good looks like, and also links things through to an ongoing and I believe annual assessment of this new tool. So trusts are required to complete the online self-assessment, and we'll see more about that in a little while. You can go to the next slide, please. So why is this important? I think the first thing is it's an opportunity to use a tool to assess where you are, but it does also have teeth in terms of the potential allocation of funding, but also the potential use by the CQC inspection team in future inspections to see that providers are fit for purpose in terms of what they're doing from a digital perspective. It also is a plan, helps us build a plan for action to improve care and outcomes, but also importantly in these challenged times to be able to identify costs and time to care savings so that we can have clinicians spend more time with patients. We'll move on. So the way things are being run, the self-assessment tool is flowing on from the digital footprint work, which Andy is going to talk a little bit more about in a minute, but which is being led by commissioning CCGs in England. The self-assessment itself is due to be completed by January 16 and involves a number of domains around governance and capability, which as I said, Andy will look into more. Then from April 16 through to 2020, digital roadmap should be executed on, and this sort of falls out of the assessment of where you are. So if we go to the next slide. As I say, the first digital footprint part is delivered by the lead CCG working with you, and you should be engaged in that process right now. And then the self-assessment, as I say, it should be being done now, finishes in January. I'm going to let Andy talk through the rest of the presentation now.
Okay, so thanks very much, Jeff. So yeah, so the first stage has already been completed, and hopefully people will have been aware of this. But what they've actually done is said, okay, so who's going to take responsibility for coordinating and ensuring that things are going to be in place? And what's happened there is identifying which are the lead CCGs. Actually, they're lead sort of coordinators for acute provision. So this sort of diagram shows clearly you've got different providers in different localities. So this is just sort of naming the accountable CCG for different providers to ensure that everybody is getting covered effectively. But this is sort of the key issue really here, is that the CCGs have got a lead role and an accountability for ensuring that things are happening and making sure that this roadmap is going to get delivered. And so for the 5-year forward view, there's a clear accountability structure for making that happen. And that's new. That's one of the new things that's happening here. If we then move on to the maturity self-assessment, now ultimately the data, the investment in the systems, the linkages, the databases, the reports, etc., will all come from the providers, the people actually delivering the care. Whether that's sort of GPs at one level, but also all of the trust, the acute mental health community, and other trusts, other providers. The whole thing here is to try and get some sort of the interoperability, the details, the notes following the patient, the data there, all in a digital format, so that there's fewer bits of paper flying around, greater efficiency, and also you can do a lot more with the information that you've got to improve outcomes and resource allocation, etc. So this maturity self-assessment is absolutely critical. And the real thing here, the real difference between this and things that happened in the past, for example, Connecting for Health, is that this is saying, this is what good looks like. And they've done it in a lot of granularity, more than ever before. And they've identified not just technology capabilities, but also organizational and communication and leadership requirements to make this happen. And, if we just look at the key domains around sort of readiness, the capabilities, and then the systems infrastructure, you can see here on the left, the readiness part, and really looking at leadership, governance. So where's this being driven out from? So this isn't about sort of separate programs. This is all about digital as a fundamental platform, as a foundation, enabling healthcare to take its full place in the 21st century. So it's moving away from siloed thinking about data, information departments in silos, records department in a silo, clinical teams in silos. This is about bringing that all together, supported in a digital way, just like in other areas of our lives. And then in terms of the capabilities, you've got all these issues here, from transfers of care, which is a critical thing here, that the data to support transfers of care flows with the patient. So this isn't about having things on pieces of paper. This is about things moving digitally, the records and assessments and care plans moving digitally between different organizations and individuals to support and improve outcomes. You've got other elements here, so that's sort of the clinical level, but clearly you've got here issues here about how populations and patients support themselves. So what are the things that they can do to take control of their own care, and so they have their own information. And then as well as things like decision support, and really important stuff around asset and resource optimization. So that's making sure that the demand and supply match, so that the A&E department at 8 o'clock on a Monday morning has got sufficient staff there to meet the demands that come in at that time of day. And frequently there are mismatches between demand and supply throughout the whole system. And that's saying, okay, do organizations have the capability to improve the way that they allocate resources, etc. And what it is all about mapping out is where you need to be. This isn't about telling people how to do it. It says, we are saying this is where you need to be, this is what you can do, this is what good places are doing, and provide, find out where you are now, and then see what the timings are and how you can move forward in the roadmap. And they're really looking in a lot of detail here about this maturity self-assessment. And this could be seen as just being one of those many things that gets rained down from above, and then you sort of do a tick box exercise and just fill it in. Or this could be seen as a really helpful tool, as Jeff pointed out, with using both quantitative and qualitative data, looking at the processes and really being critical about where are you now, and having proper evidence and data about that. And then that can be used for benchmarking and supporting the digital roadmap. So the seen as a sort of a one-off engagement at a time of contracting where it's tick boxes isn't really what this is going to be about. If you really want to drive forward this agenda of using digital, taking a leap into delivering 21st century care, this is going to be the critical enabler, just as it is in every other industry. And I think some of the limitations around seeing that in the round, seeing the opportunity of digital in the round, as opposed to in silos and just thinking about buzzwords. This is about fundamentally changing the way that services are delivered. And if we just look at a couple of these domains around strategic alignment, these are the questions around strategic alignment, and it's really clearly saying, number one, this is all supporting your organizational, clinical, and corporate objectives about delivering high quality of care, potentially having effectively a franchise that could be taken to other locations of services and networks and data flows, and having digital right at the heart of making that happen. And you can see here on the left, those questions are really quite deep. And if you look on the right, the having processes and systems and new ways of working. So we've worked in many locations where information teams are massively overloaded. They're working in ways that they were potentially, probably doing about 20 years ago or so. And in this day and age, there's a lot of tasks that should be being automated and staff being put onto real added value activities around modeling or looking at how reports could be designed so that the service managers and the clinicians, etc., have the information at their fingertips rather than having to wait for other people to do processing for things that should really be automated. Similarly, for assets and resource optimization, the trouble is the words sometimes don't really sell what this is all about. But here this is saying, okay, we want to know where are our assets. Simple things could be beds, it could be clearly the patients, etc. These are the assets, the things that are really important to the way the system operates. So where are they? Are they being used effectively? Asset staff is a massive asset. Are staff being rostered and used effectively and flexibly to deliver high quality of care for when the demands come in on those Monday mornings, etc. And on the right, these sorts of activities, those are the sorts of things that many places do have in place. They do have effective rostering systems which are very flexible. They have changed the contracts. They have sort of core staffing with flexible models on the top. So there are locations which have really seen the benefits of using data exchanges and effectively design reports to deliver value here. And that's what they're trying to get at. So you can see that the scope of the information and evidence collection is quite extensive. But if it is grounded well around the current situation, this provides a fantastic platform from which to build your route map. And I think it's the honesty and how straightforward you are about that, rather than seeing things in silos, which is going to be critical to success here. And people will be looking at this information. So this isn't just a tick box. TDA, CQC, the CCTs will all be looking at how organizations are using and leveraging digital to support delivery of high quality care, and increasingly so over the next few years as we start moving towards accountable care organizations and the different ways in which outcomes-based contracts, those sorts of things are sort of moving forwards. So that provides the baseline for the digital roadmap. And whilst there are these timescales for delivery of the digital footprint and maturity self-assessment, it's all building up to a digital roadmap about what needs to happen, how, when, and why, which is negotiated and agreed between different stakeholders. Clearly, though, this is being done at a time of contract negotiations. We've got winter pressures. There's a whole load of other things going on at the same time. And it's a challenge to deliver a high quality, what might seem to be a sort of a strategic piece of work at a time when we're just trying to keep the show on the road. And that's the real conundrum that people are facing, and where we've spoken to people at the moment is how those two things come together. And we've spoken to many executives as well, and they don't even know that this thing is on the agenda. So, and I think part of it potentially is how this is sold in, but it's critical to enabling the delivery of the 5-year forward view. And we're looking at changes in how people work, how the technology is supported, and making sure that the finances are in place. When we say that, it's actually about, rather than having separate, CIP teams, transformation teams, all these different teams meant to be doing different things. Ultimately, those resources could be better pooled to target high impact areas or proof of concepts of new ways of working, agile ways of working, to really analyze some business challenges and solve them within rapid time cycles. And that's a new way of working for many organizations. But as I mentioned, this digital agenda is going into this complex environment where everybody's meeting CQC regulations, got CIPs, got the RTT standards to meet, contracting happening, and so if you then have got this sort of view in 5-year forward view, we've worked with many organisations that have tried to tackle these sort of in isolated buckets. So yes, let's put service integration over there, let's put RTT over there, let's put CQC over there, and they come up with lots of different things that have to be ticked, and that's a real challenge. And what this is about with the digital transformation is seen as a massive enabler for all of these things to happen and move forward, and much more. So in many organizations, in other sectors and in the leading health organizations, the way that patients are put at the center and digital is there as a supporting mechanism for the whole network of organizations and individuals, those organizations are the ones which are taking the sort of coming out in the front. It doesn't matter whether you look at those people taking lead responsibility around unscheduled care, or what's happening with accountable care organisations or outcomes-based contracts. Those things are all going to be enabled by effective use of data and information. And these things will need a transformation program. So I think what we're trying to show through this is that we need to bring these things together in a effective route map, which is digitally enabled to support this sort of transformation program and to deliver these outcomes. And organizations which tackle all of these things in isolation are going to end up in a lot of challenges, and will end up not being able to cope because the requirements are just going to get greater. And sort of finally linked into this then is that some of the common challenges that we have seen, I've alluded to some of those, but data linkage around individual patients and interoperability of data, that's an absolute classic challenge. That those data sets aren't being linked, people aren't being given, have got the issues about why the data should be linked and how it should be used by care providers aren't sufficiently explained to all stakeholders, which mean there are problems around challenges around data privacy, because people don't trust how the data is going to be used. The data itself in many organizations isn't trusted. It's being transformed multiple times, frequently out of date. It doesn't really tell you where your organizational risks are, so people don't trust the data, whether that be managers or clinicians, and don't take ownership of how that information is going to be used. So they operate in a sort of more a data-free way as opposed to data-supported. Many of the tasks that are currently undertaken by people in transforming data are still being undertaken manually, and many of them could be automated, and that includes things like, let's say, data cleaning, report production, spreading the reports out to different stakeholders. They're still being done in many organizations in a very manual way. Information systems are potentially sort of outdated or been modernized, but I'm not as a big proponent to rip and replace, but there is a lot more that could be done with existing data systems with appropriate linkages between them and appropriate transformations. and that sort of architecture can be built on. And I think that's really where things are going at the moment, is to say, okay, so where is the data held? How can it be linked together? What do people want to do with it? And starting from the end user perspective and working backwards is a key thing. Poor visualization, and that's a classic for time-short people, is that they don't want to work hard to see what information, get useful information out. In our daily lives now, this is a massive change over the last few years. We've seen what can be done on smartphone-sized screens, and in healthcare and in other places, we're still left with massive tables of data points, which are very difficult to make sense of. So we need to design it for the end user as opposed to the analyst. And as I mentioned, these initiatives frequently seen in isolation as opposed to part of a whole. So some of the strategies to tackle this, we need new skills to come in that aren't siloed. So we need to architect these environments and systems, have a vision for how digital can support different stakeholders do their jobs better, and be paperless. New agile working approaches, and that's a real important one. We've got to move away from the siloed organisations. So for those that have seen Rod's the webinar on networking and agile approaches, and the organisations that are most successful, they're the ones that have time-boxed agile working approaches, focusing on analysis, tackling problems, moving on to the next one, prioritising which ones to tackle when, getting the people with the right skills together to deliver an end product. That type of approach. After prototyping, so you can actually see something, what's it going to look like, so you can believe that actually something's going to be delivered. That builds up momentum and trust. Prioritization process already alluded to, but engage stakeholders, and that's going to be critical for how the digital transformation is going to be supported. Different people have different skills around communication and engagement, and in healthcare, as in many places, frequently the people that are left with the technology are put in a room somewhere and aren't really supported to communicate how digital can really support and make everybody's jobs easier and deliver high quality care. We need to overcome that and ensure that people have got a trusted vision for how these things can actually work and be delivered, and an effective roadmap to deliver that, which is going to be programmatically supported, and that's a critical thing, and chances are going to be one of the key areas where things may fall down. New technologies, so there are a whole load of new technologies that have been come out over the last few years, but a lot can be done with existing technology, and then there are new ways to store data in far more flexible ways, and those things are now sort of coming through far more, that rather than having to program in every cell into massive databases, you can use other less structured environments and then get useful data into them. And then last but certainly by no means least, and my pet topic, is making sure that good things come out, that the benefits are realized, that you do all of the things in place, you change the working practices, you call people up when they're not working in a way which is supported by data and information, that people are debating the right things as opposed to the wrong things, that all the benefits are going to be realized. And I think that linked into the program management side of things, unless you've got an effective benefits realization sort of approach, and it's an ethos more than anything, a lot of the value won't be realized. So that's it from me. So Jess, what have we got up to on your side?
Okay, thanks very much, Andy and Jeff. Yes, so we've received a couple of questions, so I'd just like to answer some of those now. Also, just a reminder that if you do have any questions you'd like to submit, then there is still time, so you can just type that into the question box on the GoToWebinar panel. Okay, so just looking at the first question, so you highlighted on your last slide there some of the challenges that are likely to come about through this strategy, and someone from the audience has just raised the challenge of organizations having no management experience of using this digitally mature approach. So Andy, I was just wondering what you thought about this issue.
Yeah, that is that is a very big one. I think the potential opportunity for digital is, theoretically quite big, but many people haven't operated in that environment where they've seen what can be delivered. They haven't necessarily been exposed to healthcare environments or environments outside healthcare to see how information could really be used, and don't really understand enough about in the weeds of what the problems are within organizations. So if you're going to have a cheerleader or a change leader who is going to help you make this work, they need that sort of skill and experience. And yes, I completely agree. It's going to be a critical challenge because this is going to be a change in how people work, how people think. And unless, if it seems a technical exercise, it won't get the momentum and support that's needed in order to make this all work and happen. So yes, that will be a big issue. Any thoughts on that, Jeff?
Yeah, just to add, I think it's very important to try and learn from peers, because in the UK there are some trusts that have got further than others, and most trusts are very willing to share experiences, but also important to learn from international perspectives. So with some of the big EPR deployments, these companies have deployed their software across the globe, and in some parts of the world they've got further with the same systems. So I think it's important to reach out and learn from those.
Thanks, Jeff.
All right,
Yes.
That's great. And just moving on to another question now. So somebody just asked if there was any money going to be coming with this initiative.
Andy, do you want me to talk?
Yeah, you kick off on this one because you heard from the horse's mouth.
Yeah, so I was in Birmingham. Well, post the comprehensive spending review, the money that NHS England itself has amounts to this 1 billion over the Parliament. However, the thing that I think should be a take-home thing from this is that the rest of the behaviour of the centre in terms of allocating capital from the DH and the Trust Development Agency will also be heavily influenced by what you do. And what Beverly Bryant was saying is that it isn't about being good per se, but being knowledgeable about where you are and with a clear plan. So I think yes, there will be funding, and it's going to be based on your maturity, honesty, and grip on the situation within your local organisation as to how well you prosper with that.
Thanks, Jeff.
Okay, and so just moving on to another question here. So just wondering what it is that should be done first. Maybe if Andy, you want to take this one?
Yeah. So, well, I think in this webinar we've described quite a lot that need to happen. I suppose the first thing, it depends on your starting point, but the first one is on your digital footprint. What does that look like? So you need to get in contact with your CCGs, etc. Okay, so who is responsible for this? Who is pulling this information together on in the CCG? And then in the provider, there will have been a communication to the trusts to do the maturity self-assessment. You need to find out who's leading that, and are they doing it in a way which is going to deliver the sorts of quality of evidence and baseline which is going to enable you to have an effective discussion about that route map. And that route map is very wide in scope. So who's leading that? Who's leading that sort of self-assessment? And how are they doing it? How are they getting this information together? Where are they pulling it from? Who is being engaged in the process? So that's sort of the next thing. And then it links into how is the roadmap going to be coordinated and designed. And this is where we need some, a little bit of creativity in the room. And this can't be done sort of by someone just sitting in a room somewhere and trying to sort of design the whole thing. This is about a collaboration between different stakeholders, but with a clear baseline on Where are you with technology? What are the things that you could do? What are the things you could do at no cost, medium cost, higher cost? What are the different pragmatic solutions to get to where you want to get to? How could things be linked together? Who do you need to get on site? And that roadmap of those sort of tactics and plans with an effective work process. So what is that sort of agile work process? Who's actually going to lead that? What is the team that is going to make this happen? And where are they getting their ideas for improvement from, and how are you engaging your organization? So in terms of the first couple of things, who's involved, and then the real thing around there, once you have got that sort of baseline, is that going to be the high quality baseline that you need that Jeff described could be critical to sort of potential funding decisions, and as a minimum enabled you to have a really strong baseline from which to develop that roadmap, and then who is going to be engaged and how to develop that roadmap with the CCGs. So those would be the starting points for me. Any other thoughts, Jeff?
No, I thought that was a good answer. Thanks, Andy.
Okay, well, we've run out of time this afternoon. If we didn't get to your question, feel free to email us and we will follow up with you directly. But before we go, I just wanted to let you know we are having our second webinar on the 20th of January. This webinar will focus on the experience to date, looking at to what extent the Digital Maturity Index assessment has been taken up, how the findings of the assessment have been leveraged, and what the issues and risks have been. Thanks again for joining us, and we'll hope you'll be back to the next Optimity Advisors webinar. Thank you.